If you're caring for someone with dementia, there are 5 problems you really don't want to wait until they become an emergency before you start to deal with them. The trouble is that some of these start very small signs, and it's very easy to miss them or just think, oh, that's just the dementia or just that's them getting older. So in this video, I'm going to show you 5 things to watch out for and why it's worth acting on them early. Think about a small leak in your house. You don't know, it is a leak yet. You just spot a small damp patch and think, I'll keep an eye on that. But if you leave it and it doesn't necessarily stay a small leak, it can spread to severe water damage and eventually become a much bigger problem that's harder for you to deal with. Some problems in dementia care can be like that. I'm not saying every small change is an emergency. I am saying it is just easier to deal with a problem while it's still small than when, you're dealing with the consequences of it becoming much, much bigger. So let's start with constipation. Constipation is one of those things that I think that can be easily overlooked. If you're caring for someone with dementia, particularly if they have mobility problems, constipation can become a real issue. The thing here is that you don't want to wait until it does become full-blown constipation. And there are really, things you can do to stop them from struggling. You want to notice those signs early and do something about them, especially if the person you're caring for may not be able to tell you that they're constipated or explain that they have an issue. You might even notice that they're behaving differently, but without immediately connecting it to constipation. But there are a number of reasons why bowel habits might change. Maybe they're not drinking enough. Maybe they're, eating differently, something. Maybe they're not moving around as much as they used to. And maybe there's a change in their medication. It could be a number of things. But the point is, a couple of days without a bowel movement can turn into something much bigger. Constipation can become severe and may need medical attention. So talk with your doctor as soon as you spot it. The signs, basically. If you notice things are changing, don't just leave it and hope that it will sort itself out. Deal with it early. I used to keep bowel diary or a chart, basically, because it was surprisingly easy how the days could run into each other. And before you know it, you've lost count of the days and you realize that they've not had a bowel movement for, a proper bowel movement for a while. My mother dealt with constipation caused primarily by her pain medications that she was taking, and also due to the lack of movement because she then became wheelchair bound. And the remedy was working with the doctors until we found the right sort of combination of laxatives that worked and combine that with, a diet that was rich in fiber and keeping up the fluids. And I know that's easier said than done, but it can be done. And actually, that idea of noticing something small before it becomes something, much bigger takes us neatly into the next point, because sometimes the first sign that there is a problem isn't what someone tells you. It's, what's happening when they're trying to eat or drink. This is a particularly important one because eating can change gradually, Perhaps someone is taking much longer to finish a meal that they would normally have eaten quite quickly. Perhaps they're suddenly struggling with foods that they used to eat quite easily. They might be, coughing during meals. They might be repeatedly clearing their throat. My mum did that. Or they might hold food in their mouth. Or perhaps they're simply just eating much less than they normally would. It's easy to think that they're just not hungry today, or sometimes they aren't. But if it's a repeated pattern, that's what you want to pay attention to. One cough may mean nothing. If it's an ongoing or it keeps happening at meal times, that's different. Now, if they're coughing regularly when they're eating or drinking, that's something that really does need to be paid attention to because there could be an issue with swallowing. And that's something that is related to dementia. And it's something you can't ignore. The first step would be to speak to your doctor, who can assess whether or not this is what's happening. And if that's the case, they'll probably refer you to a speech and language therapist. And they are brilliant people that can help you with eating and making sure that your loved one is able to swallow properly. Don't wait until eating and drinking has become a real struggle before you do something about it. Sorry about that. My glasses are steaming up because of the heat, so I've had to turn the fan on. Anyway, let me bring you to the third point, which is dehydration. And again, this can creep up because it can be very easy for drinking to slip down the list when you're concentrating on the needs that you do for your loved one. Sometimes it starts with them simply just drinking less than they used to. So keeping an eye on how much they're drinking and noticing if there's been a change is really important. Someone with dementia might forget to drink. They might not recognize that they're thirsty. They might have difficulty getting the drink themselves, or simply they might have lost interest in drinking. And if you're busy dealing with everything else that goes around caring, it's very, very, very easy to realize that they haven't actually had much to drink that day. I found the easiest way is to just make it part of the routine. You don't need to make it complicated. It's simply about making sure that the fluids doesn't become one of those things that gets forgotten about until somebody is already unwell. And if you're seeing signs that they're not drinking enough, or you're concerned about them becoming dehydrated, that's something to act on immediately rather than waiting on it. Because it can obviously lead to a bigger problem, especially, if there are particular circumstances where their dehydration becomes more of a risk, such as now, like we're going through a heat wave here in the UK, or they could be having an illness, or they could, be having a spout of diarrhea. And then hydration is so, so important then. So don't wait until someone is obviously unwell before you start thinking about their fluid intake. Small things matter when you're trying to prevent a crisis. Again, I would suggest keeping a chart or a note of fluid consumption somewhere, in a diary or on a wall chart. I know you can see a pattern here that I like to use things to keep track of things. And these days we all have like mobile phones, and these have all got apps on them that you can track different things on, or you can just use the note section on your phone. Now, the fourth point is one where you can have the temptation to dismiss as something about them getting older, as part of normal behavior, and that's around mobility, especially with falls. Another area where small changes can be easy to overlook. Perhaps someone who normally walks across the room quite comfortably has started to hold on to furniture in the room. Perhaps they're taking longer to stand up, or maybe, they're becoming less steady. And you might be thinking, that is just part of getting older, that's nothing. But a change in mobility is still something that's worth noting, and particularly if someone is becoming less steady. Wait until they actually fall is not a good plan. If somebody starts doing these things more often, don't just accept that as part of their normal behavior or getting older. And the important word here is more. It could be something straightforward. It could be something that needs attention. But the point is not to wait until there's a real crisis, like a serious fall, before you start asking questions and looking at prevention or making changes. Because prevention is much easier than dealing with, the aftermath of the major injury, sometimes a change in mobility can be connected with other problems. So they may have mobility issues because of the pain or illness or medication changes or just general weakness. Even dehydration will count. So if that's someone you see suddenly moving differently or more awkwardly and it's not their normal, usual pattern, don't assume it's part of the dementia. Make a note of the change and then get advice if you're concerned that could help in terms of thinking about how you can adapt the home, maybe giving them walking sticks or building in exercises or a walker for around the home. These are things that we can do to help our loved one before things become a crisis. And that brings me to the final and fifth point, which is probably the easiest one to dismiss as simply being part of their condition. And that's increased confusion. If someone suddenly becomes much more confused, again, it's so easy to dismiss. But actually, I want you to stop and ask yourself, what's changed? Has there been a change in their medication? Could there be an infection that's in play, such as a UTI? Is there something else going on physically that they're not telling me about, like pain? Are they usually Are they more sleepy than normal? These can all be different reasons for a sudden change in confusion or behaviors. And that's why it's always worth getting it checked rather than simply accepting it as part of the dementia. And particularly, again, when that change is sudden. That's something I wouldn't ignore. Think of it like a warning light on your car. You don't necessarily know exactly what's wrong just because the light has come on, but you know that something needs checking. And that's really the message that I want you to take away from this video. These aren't 5 things to panic about. They're 5 things to watch out for, because the earlier you can spot a potential problem, the more chance you have of dealing with it, especially while it's still manageable. Constipation, changes in swallowing and eating, dehydration, mobility, and sudden increase in confusion. You don't have to know what's wrong. You just need to recognize when something isn't right and do something about it. Take it seriously. Get advice. What's the worst that can happen? The doctor will just say it's okay, it's normal behavior. It might be nothing. But the more you question, the stronger your gut instincts become to recognize when problems become serious. And if you're caring for someone with dementia, I'd love to know, what small problem that you've learned not to ignore. Leave it in the comments, because your experience might help another caregiver dealing with the same thing. Thank you so much for watching. My name is Kat, and I cared for my mother with Alzheimer's for the last 13 years, I was going to say, but not last anymore. And I'm sharing from my lived-in experience to help other caregivers. And if you like to look at one specific problem that can be difficult to spot in someone with dementia, I've also made a video about UTIs that you can watch and how to spot them. And you can watch that right there.